The reason we're recording it is because Shaw Cable has asked to rebroadcast the town hall, this one and our future ones as well, so that other members of the community can enjoy the content and learn more about what's happening during this COVID-19 crisis. So with that in mind, please make sure that when you are not speaking, that your microphone is muted. And probably not a bad idea to have your video turned off, although it's your choice, just from the perspective of this being broadcast on Shaw. We don't probably want to have everyone's video broadcast from their home. So, so keep that in mind. We will be taking time at the end of the presentations to take questions, either from either general questions that anybody can answer, or specific questions if you have those for our panelists. You can enter those in the chat box if you would please, and then we'll be moderating those and trying to combine ones that are similar so that we can be as efficient as possible in responding to those questions. So today's presentation is going to be as follows. We have, I'll say a few words about what's happening with the Community Foundation. Then we'll have Dr. Tim Phillips speak. He's a local doctor, as well as Tracy Van Raes from the Starship program, Tracy Comber from the Superteria, John Bubb from the Summerland Food Bank, and Major Paul Trickett from the Salvation Army and the Penticton Food Bank, and Marie Tar from Desert Sun Counseling. Those are our presenters for this week. As mentioned previously, we will be hosting these sessions for a few weeks now into the future. We'll determine what we do down the road as demand changes for this type of activity. But for the next little while, we'll be hosting these every Wednesday at 2 p.m. with a slight change in topic and different presenters each time. So if you have suggestions for who should be presenting, if you'd like to present, please give us a call, contact us about that, and we'd be happy to talk to you about that. So now just a little bit about what's happening with the Community Foundation. As with most people nowadays, we are working from home. We are very fortunate as an organization that all of our staff members are still working full-time and actually extremely busy at this time, trying to support local charities. Fortunately, we were set up for remote work just about a year ago, so most of us are able to connect without any trouble. So there are 4 staff members at the foundation, and all of us are working from our homes. In terms of new things that have happened for us, we have recently launched the Community Response Fund. This is a fund that we have launched in partnership with the United Way, the Central Okanagan Community Foundation, and the North Okanagan Community Foundation. So the 3 foundations in the valley, as well as the United Way, which are the 4 primary funders, I would say, for the region. That fund is available for individuals to donate to help support local charities, but also the Community Foundation of the South Okanagan has seeded our local fund with some of our grant reserves to help us respond immediately to needs in the community. First example of that being supporting the Superteria to allow the Superteria to get itself back up and running as quickly as possible. So that's our first emergency grant. We are also accepting grant applications for the entire region through our Community Foundation's website at cfso.net. Those applications are extremely easy to complete, not as rigorous as the typical application cycle, because we want to make this as pain-free as possible for charities that we know are under a lot of strain right now. So at this point, I think we have 35 applications from Vernon south to the border. The 4 funders that I mentioned, the United Way and the 3 community foundations, are collaborating to try to find efficient ways to fund as many of these emergency requirements as possible, so that we can work together to spread the support as far as we can. We would also ask that others who are considering funding local charities at least considering talking to us before making those funding decisions, so that we can coordinate as much as possible and try to meet the most urgent needs together, so that we are on top of what's happening in our communities. We at the Community Foundation are working very hard to know what's happening throughout the entire South Okanagan Similkameen, and what might be happening in the next few weeks, trying to anticipate future problems that haven't come to light yet. So if you're interested or have inquiries about where the need is greatest or where you might be able to have the biggest impact in supporting the community, please give us a call. Let us know what you're interested in, and we'll do our best to coordinate with you to find a good solution that supports the community. As I mentioned, there is one regional application for support. So charities typically would have to apply to the community foundations in each region, Vancouver Foundation, United Way, all separately. We've combined that so that it's one application cycle to make it as simple as possible for everyone. And as I mentioned, we will be hosting multiple town halls for the next few weeks. Some of the ideas you see listed here, municipalities hearing from our local municipal leadership as well as the regional district and federal and provincial leadership as well would be one potential topic. These are, by the way, in no particular order. We're still planning that out. We'd like to hear from our education system as well to see how things are going with remote schooling. I know from the experience of my own children that remote schooling is a little bit of a challenge, but I think they'll get it worked out as they go along. There's some interest in talking about safety and security in our communities with the isolation that we're all experiencing, as well as there's been a lot of conversation about how we can support our business community and also the nonprofit sector, not just the charities, but local societies, and how they find stability during this time. So those are some of the ideas that we're considering, and we we'll refine that as we go. As I mentioned, if you have suggestions or ideas for us, please feel free to let us know. We're certainly open to adjustments on this. It's a very fluid process that we're undertaking here, just like everybody else. So we'll be open to rapid change to meet the current need at the time. So now, with that in mind, I'm going to go back to our agenda here. So Dr. Tim Phillips is our first presenter. I see, yes, Tim is on the line. So Dr. Phillips, can you unmute yourself and just give us a little bit of a background for what's happening in our region right now in terms of the medical profession, what you've seen, where the strains are, that kind of thing. Just give us a bit of an update if you would mind.
Okay, sure. You can hear me okay?
Yes, you bet.
Okay, good. So my name is Dr. Tim Phillips. I'm a family doctor in Penticton, and I'm also the physician lead for the South Okanagan-Similkameen Division of Family Practice. So we cover family doctors from Princeton, Carameus, Oliver, Soyuz, Penticton, and Summerland. For the past number of weeks, like a number of the other physicians around the province, we have shifted primarily to doing a lot of telehealth, both telephone and video conferencing with patients. One of the challenges that we have as a physician community is the same challenge that happens for healthcare providers throughout North America and throughout the world with this is the general lack of protective gear, PPE. And so most of what we do these days, like I mentioned, is done virtually. We are open and available on a regular basis, and most of it is being done through booked appointments. So it's the process is the same, where you call your GP or your NP's office, you book an appointment, and we connect with you either on the phone or through one of the many video options that are available to us. Our specialist colleagues have shifted to doing a lot of the same type of process. I know a lot of the internists, the cardiologists are following up through telemedicine and video conferencing. And when possible, the orthopedic specialists have been doing the same thing. Definitely, we recognize that there are times when people need to be seen. Just because we're working in a world of COVID where that's kind of standing up and becoming one of the high priorities, everything else, it's not like everything else has gone away. So people are still going to struggle with abdominal pain. They're still going to struggle with back pain. There's all of the chronic conditions, their diabetes and their blood pressure issues have not gone away. And there are definite times where people need to be seen for those. So what we're trying to do with those is manage those valuable PPE resources and try and set things up so we're minimizing the need and the use and the variety or the number of physicians who need to be wearing PPE throughout the day so that we can try and preserve that in our offices. So sometimes that means when you call up your provider, the person who, if you need to be seen, you may be seen by one of their colleagues. Definitely, like I mentioned, we're open for business and we want to be there for our patients. And it does take a little bit of time for us to get used to working in a new way. One of the things we've worked with is to try and set up over the past few weeks is we've worked with our interior health partners and with the community of Penticton to set up an assessment clinic here in Penticton that is especially focusing at this point in time on people with respiratory symptoms who potentially may have COVID or are worried that they might have COVID, so that we have a place again where we can maximize the use of the protective gear we have in a way that will preserve it and keep us going for a longer period of time. In order to access the appointments, the process is to still go through your provider, your NP or your GP, and call the office, and then there'll be a video assessment that'll be done with your provider to see whether you need to be seen and whether that's an appropriate site for you. And at that point in time, we'll book an appointment for you to be seen by the GP or NP that's working at the site there. We're potentially looking at the idea of consolidating some of the other assessments that need to be done, but that's still a bit of a work in progress for us.
So, Dr. Phillips, is that the assessment that you would do, is that what's happening at McLaren Arena right now?
Exactly. So that's the McLaren Arena site. And so, like I said, initially it was set up for those people who had respiratory symptoms. We don't have the ability at the moment, because it is an outdoor site, to do kind of full assessments and lay people down. But the docs who are there are able to, have conversations, see where we're at, have a listen to your chest, and we can do an assessment that we can do with a chair or with somebody sitting in a chair. And then if there's something that we feel needs a higher degree of assessment that we're able to do there, we've got a good connection with the emergency department at PRH, and we're able to move things along fairly quickly through there and communicate with the docs working in the emergency department.
Great. So we just last question I'll ask before we have to move on. But from your perspective, just obviously a personal opinion, how do you feel our medical professionals are holding up through this? Is the strain getting to them, or is everyone doing okay?
So we have regular check-ins since this has started over the past few weeks. And initially, it was a daily check-in in the morning. It's sitting at about 3 times a week now, and it's a really good opportunity for us to work through and talk through some of the challenges that we're having. Definitely IT is one of those, getting used to a new way of doing business and trying to work out what is the best way of doing things. And so, yeah, we certainly can hear some of the concerns and some of the frustrations that come out. But I think on the whole, everybody is still very positive and working really hard and holding up pretty good.
Great. Excellent. Well, thank you very much for that, Dr. Phillips. Can I ask now Tracy Van Raes to turn your microphone and your camera on, Tracy?
Yeah, I'm here. I don't know what's going on with my video. It works every other day. Oh, there we go.
Yeah. Okay, so Tracy, you're with the Starfish program, right? And
yeah.
Do you want to give us a little bit of a sense of what Starfish is and then what you're dealing with right now during this crisis?
Yeah, for sure. So Starfish is a backpack program of food for kids in need in our community. We deliver during the school year every Friday a backpack full of food. We currently deliver, or we have delivered to 8 elementary schools. 60 children is the amount of kids that we help every weekend. in the school year. So obviously COVID-19 has presented a few different challenges for us. One being that, so to back up, Starfish is a Rotary initiative. And we partner with Save On Foods, who provides the food for us. Rotarians pick up the backpacks from Save On Full, take them to the schools, and then they go home on a Friday with children, and then they come back empty on Monday, and then we start the process all over again. Just February-ish, we moved to our packing station to the Elks Lodge in partnership with them, and then Big J's Express Moving was picking up the food, and that's how we were able to expand to 60 children from about 46. So that, obviously the logistics of that don't work. We can't collect backpacks at this point. There's also a confidentiality concern with the kids, as the kids that are on this program are decided by the schools and the administrators and the educators. So the volunteers never actually know who the kids are. They just know they're helping some children out of school. So that presented kind of a concern. The backpacks themselves and transporting was a concern. And then also with Save On Foods, the buying power was a concern. Our grocers are having a hard time fulfilling specific orders. So what we've done, how we've responded, is we have gone to a gift card model. So starting next week, our 60 families will still be able to access Starfish, but it will be a $25 Save On gift card. And that gift card, those gift cards will be picked up by me at Save On Foods and delivered to School District 67, so that the educators there can distribute them to our 60 Starfish families. The need is much bigger than 60 kids. It's double, if not more, identified vulnerable children in our community and that's just within our school system. So this School District 67 is working to come up with a plan for the rest of the kids, and maybe some sort of weekly hamper, and our Starfish gift cards will be handed out to those specific 60 families with the hampers that School District 67 is currently working on. So there's more to come with that next week. Sean Gao at the school district is working on that, as well as Sandra Richardson.
So Tracy, how do you feel, like what are the pros and cons of this change in going from the backpack full of food to a gift card? Is it, like, obviously a gift card in some ways is less labor intensive and it's direct cash for food and so on, but there would be disadvantages, I assume, as well. So what would you say that you're dealing with there?
Yeah, so we're not really going to know until next week when it starts up, hopefully, and we'll work through any challenges that are presented to us. For now, we have Starfish is in 19 communities throughout BC. So I've been collaborating with the Starfish chair people from those other communities, and some of them have been doing this already for a couple weeks because their spring breaks went back early. So I've been learning a lot from them, and one of the things that came up in the last few days was our Save On Foods has written Starfish on the gift cards, because we want to make sure that those gift cards aren't used to purchase tobacco, liquor, and lotto. So that was one disadvantage, I guess, that came up in other communities. So we've addressed that already. And the other thing too is I kind of feel like this is a good shift. If School District 67 is able to provide a hamper with some non-perishable items, and we also know the food bank is helping in that situation, with that gift card, maybe they can buy some fruit and veggies or milk products or some kind of protein. So I'm interested to see what the feedback is on this.
That's great, Tracy. And there are a few questions coming in for you, but I think we're going to hold those for the moment and just make sure that all of our presenters have a chance to speak, but we'll get to the questions a little bit later in the program. Now, I'm pretty sure that Tracy Comber from the Superior is on the line, but not 100% certain. She may come in as a guest. Are you there, Tracy? Give it a second to see if she comes online. Let's see here. I think this might be Tracy. Are you there, Tracy? Is that you that I just unmuted?
Yes, I'm here.
Okay, great.
Can you hear me?
I can hear you, yes. Yeah, so
Oh,
Tracy,
good.
you could introduce yourself and the organization you're working with and what you're dealing with right now, please.
Well, my name is Tracy Comber. I'm the president of the board of directors for the Penticton Superior. We went through a little bit of a rough time here, just trying to figure out how we were going to be able to move forward and keep our volunteers and our clients safe. Just a little background. So I went back and forth with the city and the health department and the board, and we had a lot of discussions, and we came to the conclusion that we couldn't do it as we had been for many years, and we chose to close down after a lot of thought. Anyway, at that point, I sent out a letter to the city and to the Interior Health, and we decided that I put a proposal together to hire people and not have the volunteers here. The reason being is we've had 125 volunteers at any given time that come and go from the Superior. So it was almost impossible for me to put new rules in so that they would socially distance, and the room here wasn't big enough to have that done with social distancing with 8 or 10 people in the room. So when we closed it down and reopened again, we had 4 people hired. I'm one of the people, and only 2 people work at a time. We're able to build the lunch bags and the sandwiches with 2 people and get them out to our clients. So the first few days that we were back in operation were a little bit slower. We had, I think, 45 the first day and 55 the second day, 65 the third day, and now we're up to 75. And I'm seeing that it's some different faces coming out. I sort of wonder if it's going to continue to climb. Some of the people that we would normally see, we're not seeing. And then some of the other people are, completely new to us. So I have a feeling that the need will just keep growing over the next little while until things get sorted with this COVID-19.
So Tracy, you reopened on which day, sorry?
Last Friday. We were closed down for 4 days.
Right, okay, great. And you have 2 people working at any given time, and you've received funding from the Community Foundation, but partnerships with Interior Health, the city, One Sky Community Resources as well. How has that changed the way that your board is thinking about the future for your organization?
Well, I really can't even say how it's changed the future. For right now, it's working, and I feel like it's working really well. The people that I've hired on here are fantastic. There's, 3 other young people, or not that I'm young, but they are, and they're fantastic. So we've got an annual general meeting coming up, as well as, we need to have a board meeting. It's a little bit more difficult with our board because some of them don't have technology. So
Right.
We have to figure out a way to include everybody in those meetings. So far, it's been everything going back and forth on email, and I'm not sure if anybody else has been dealing with this, but it becomes really cumbersome if you're the one that's reading all those emails coming back. So it's nice to be able to have a meeting like this on a Zoom. I normally would be on my computer and have video as well, but I'm still at the soup kitchen right now. So
Right. So,
yeah.
and how do you, how long will this current arrangement keep you going with the current funding?
The funding, well, when we voted on it as a board, we voted on 2 months, not knowing how long this would go on for, but everybody's pretty sure at that time that it's going to be at least 2 months. So with the funding that we have, we'll be able to pay the 4 people, pay the employer expenses on top of that. One guy is administering all the payroll for us, so that's fantastic. That takes a big load off our shoulders. And also, it'll give us a little bit extra to what we've been trying to do is have a table on the side. We always get breads and different donations from all the stores, IGA, Save on Food, Safeway, Nature's Fair, Wholesale Club, Cobb's Bakery. So they give us donations. So what we do is we use the breads as we can. And every lunch bag, they get a piece of fruit, juice box, napkin, what else? Oh, a dessert. And then when they come up to the window, they come up to the outside patio, we give them a choice of 2 sandwiches. So they get a fairly good lunch. But on top of that, we have a table to the side and we ask them if they'd like extra bread, buns. Sometimes we usually have a couple of trays of extra treats, like maybe muffins or whatever we have for that day, cookies, bear claws, whatever it is that day. So yeah, they get a little bit of extra. I figured, or we all figured, that they're just as scared as the rest of us are of this, and a little extra comfort food doesn't hurt.
Yeah, good point. Well, we'll get to questions again as we go further here, but I'm going to now ask John Buck from the Summerland Food Bank to come on and turn on your microphone and your camera if you've got it, John, and we'll go from there.
Yeah, hi, Aaron. Thanks. I seem to have lost part of my display here, but I'll continue on. Are you hearing me okay?
I can hear you, yeah.
Great. Okay, well, first of all, for those of you that don't know us so well, we're called the Summerland Food Bank and Resource Center Society. And in addition to the food bank, which has been running since 1984, we support 15 agencies in Penticton that deliver 19 different programs within our office. And then out of our office ourselves, we deliver something called the Odd Job Program, which provides short-term employment for people that are out of the workforce on the street and so on. We have something similar to the Starfish program, called the Penny Lane PACS program. It's financed primarily through the foundation and the Penny Lane Society. And we host the Summerland Child and Youth Committee in our office, and we also support the Summerland Fresh Fruit and Vegetable Stand, which is sharing vegetables through the summer period. We're open 5 days a week. And we remain open, although with reduced hours. We're open all day on Tuesday and Wednesday, which are our main food distribution day and our main counseling day. And then the remainder of the week, we're down to half days, working just in the mornings. We're in really good condition right now, really good situation. We're continuing to operate, continuing to meet the demand. We have reserves in place, both cash and food reserves. Our donations have gone almost crazy in the last couple of weeks. We're doing extremely well in terms of the community supporting what we do, and they always do that, and we're so appreciative that we don't even most times need to ask. People step up. Our suppliers of food are behind us as well. Our 2 grocery stores, Nesters and IGA in Summerland, and the suppliers that we use in Penticton are also have our back. They're putting items aside for us. We are talking to the schools at the moment. Linda Van Alphen is coordinating that program, and we expect to be distributing boxes of food to the families that we usually deliver the Friday packs to. And we're anticipating that that could go to 18 or 20 families in Summerland, but we think really at the very start of trying to assess what the impact of this whole thing is going to be on us. I'm not sure that I can give you much more information. I'd be happy to answer any questions that you have, though.
Well, I'll again just ask our participants if they have questions for you to enter them into the chat for later. One question I have for you, John, is in speaking with your clients, what have you heard from them in terms of how this situation is affecting their lives?
I don't really have a clear answer for that. Hal Roberts is our full-time employee, and he has most of the interactions with the clients are directly through Hal. I'm not aware of any problems or challenges. He hasn't come back to the board with any serious problems. We've obviously adjusted our way of handling food, and we're delivering hampers and other materials in the parking lot rather than having people come down to the food bank. But we've got people coming down there for showers and laundry and to use the kitchen and to use the internet. So we don't feel that we can shut that down, but we're also not seeing a major demand right at this point in time. I think this month will tell us the future is going to look like. But by the time we get into the next couple of weeks, some of the government programs should be kicking in with income. So we're really not sure. We're just trying to be as prepared as we can for everything that comes our way.
Great. And last quick question, is the Odd Jobs program still functioning, or is it on hold?
It is functioning as long as we can maintain the social spacing that we need. We have a truck and we have 2 drivers, but we're restricting ourselves to jobs that require 1 driver, 1 truck. Our coordinator, our Odd Job program coordinator, also drives, so she's using her own car. So as long as we're able to maintain the social distancing, we think we can continue to provide income to some of those people who typically don't fall under any government programs at the moment. Yeah, it's so we are hoping if we need deliveries, which some families may need deliveries, that we can use the Odd Job program to do those deliveries, and we will pay the salaries of the employees that are doing that ourselves.
Okay, that's great. Thanks for that update, John. I'm glad to hear you guys are doing fairly well and you're coping with this situation. Now to the Penticton Food Bank, the Salvation Army, and Major Paul Trickett. Can you sign yourself on and unmute yourself? Okay.
I can't get any video. It's not allowing my video.
I just sent you a request to turn on your video. Maybe that'll help. There we go.
That good?
Yeah, you betcha.
I'm also with Al Madsen off to the side. We're trying to keep our social distancing, and John Rankin, our director at the food bank.
Excellent.
Welcome to everybody, and I want to start by saying thank you to everybody out there, because if we don't do this together, it can't get done. I want to start by saying we are seeing an increase definitely in people coming to the food bank. Our planning meetings here on our end are not just based on today. We're really basing that we are looking what's going to happen when this is all done and over with. We're looking 6 months to a year from now and trying to project that far ahead, because we are seeing that this is going to be a great need going forward. The economy is definitely going to get hit. We are already seeing laid off people coming and asking for help and inquiring. A lot of people that have never used food banks in their life, that don't know how to access food banks. And we're trying to get that message out there that we are here to help. And, you know, the Salvation Army, one of our slogans is giving hope today. And that's what we want, just people to have hope. our food donations have dropped because we've missed out on at least 4 major food drives. We do have bins out at all the local grocery stores and major grocery stores, and we're seeing those well utilized at this point. We're also taking cash donations in at our church location and at our food bank, and cash, Visa, MasterCard, all that kind of stuff. We're doing that as well. We've upgraded our system to meet that, and we now have a debit machine. We can take things over the phone, and people can go to our website at pentictonsa.ca. We're trying to get more technologically advanced in this because we know that the need is going to go. We know the need's going to go well past the next couple of months for us anyway. Like I said earlier, our hampers are extremely steady. We have a lot of walk-ups every day. We give bags out. I want to thank God that the Superior was able to find a way to open again, because when they did shut down, we did find a lot more people coming in because of that. So working together with other agencies is a priority for us to keep everybody going so that we can all weather the storm. We have over 100 people every day walking in just for a bag of handout, which is a quite significant amount of food because we have it. Just to let you know, our hours of operation, Monday to Friday, 9 to 12, and then 1 to 4. We do shut down on stat holidays, but we've decided to open Monday just because the need is so great out there. And Thursday, we are going to be just giving extra out so that it meets people for not being open Friday. Again, all the other agencies, some of the agencies we work with are St. Vincent, Discovery House, Superior, Friendship Center, Solens, Compass House, Oasis. And again, we just want to make sure everyone's taken care of and helped. And we are seeing such a great need, and we know that it's going to get greater and greater and greater. And we've decided on our end, we just, as best we can, and we do trust, I'm a preacher, so I'm going to say it, I trust God. We are saying that no one will be turned away. We will make sure people get something. And but we just need that partnership out there to make sure the food and money is coming in so that we can make and meet that promise.
That sounds great. You are in a position then where you would be looking for food donations, I think you're saying?
We need food coming in, yes.
One of the comments that just popped up isn't a question, so I'll just state it. Tracy Van Race has pointed out that JCI is doing a food drive on May 2nd, so that's going to be coming up soon as well. So, and I'm sure there's going to be lots of other opportunities for that in the future. So I do have another question for both of the organizations that run food banks, but I think I'll save that for the Q&A at the end. So thanks very much for that very detailed presentation, Major Paul, and I'll get you to, if you could mute yourself now, and I'll get Marizi Tar to come on from Desert Sun Counseling. If you can unmute and bring your camera up if possible, Marizi.
Yes. Good afternoon, everybody. My name is Mariza Todd, and I am with Desert Sun Counseling and Resource Center. So we provide counseling in the South Okanagan for both the communities of Osoyoos, Oliver, OK Falls, but we also run a community kitchen. We do parenting programs. So we provide a variety of other programs in our area. And then I am also a Rotarian. So I started the backpack program. We don't call it the Starfish backpack program. We just call it the backpack program 6 years ago. And we do it in the Osoyoos Elementary School. And we do that with funding from the Rotary Club, as well as both of our grocery stores. They provide us with food on a weekly basis. Lake Village Bakery also provide us with bread every week. But I am really concerned about the future of this program because Rotary has just missed out on or we are going to miss out on two big fundraising opportunities. So and the need is, as we all know, a lot greater. We currently helping 9 families, but we know there's at least 12 families who are in urgent need. So we need extra 2 or 3 to help 3 extra families, and then we would like to provide them with a little bit of extra food, especially now that these kids are not in school Monday to Friday and they are not accessing the free school lunch program and the free breakfast program that we offer at our local school. So that is my one ask. I have put out an ask to our community, and I have to say the response has been really, really good. We are now going to partner with the food bank as well. And we are also not going to be using backpacks because of the risk of transference. So we will be using boxes and brown paper bags in future. So with the help of the food bank, and then also with our grocery stores, we would like to continue and expand this program, but we are going to need extra financial support moving forward to be able to help 12 families instead of the 9. Then we have also always run, Desert Sun Counseling have also always run a community kitchen. And the community kitchen, at the community kitchen, we work with approximately 30 different families who we know struggle with food security. And so every Thursday we have a facilitator who provides, or the parents and the facilitator comes up with different recipes. They cook a meal together. They then have lunch together, and they make enough for the parents to take at least another meal home. So as soon as COVID happened, we knew that we could not continue that because we didn't have the space for social distancing. So at first we thought of changing it up to virtual kitchen so that the teaching piece would still be available to families. And so after talking to Tracy from Subteria and also to Interior Health, we have decided that there's a greater need at the moment for the food security piece than there is for the teaching piece. And so and this has literally happened in the last 24 hours. Things have changed from the virtual kitchen to the actual kitchen moving forward. So now our plans are moving forward. As of next week, we will start on Wednesday. Our kitchen facilitator will be cooking a meal on the Wednesday with 2 volunteers, and these will be the parents that normally, 2 of the parents who normally attend the kitchen. They will then prepare a stew or soup and freeze it from Wednesday to Thursday. And then Thursday, we will coordinate pickups for these families to come in and to pick up frozen meals as well as bread. And we are hoping that that can actually provide families with at least 1 healthy meal for the week. We are now also going to the week after, we will be doing the same thing on a Monday and a Tuesday. So going in on a Monday, preparing a meal, freezing it, and then on the Tuesday, we will only be helping seniors. So Tuesday will be seniors and Thursday will be for families. And then we have also just been approached by a local hotel, and they would like to partner with us and provide us with a box lunch, which we will then be able to add to the frozen meal on the Tuesday and the Thursday. We normally work with about, as I said, about 30 families, but we now know that we have at least 50 seniors who have shown interest and approached us to ask for these frozen meals. And we know that there are more than 30 families out there that are going to need help. So food security, we know from the clients that we serve and from what we have heard from them in the last 2 weeks, that this is going to be, that a lot of families are going to find it difficult to put a meal on the table or meals on the table. And so we really would like some support from the Community Foundation so that we can help as many people as we possibly can. And I agree with the person from Salvation Army that I don't think that this is only going to be a 2 or 3 month thing. In our area, we rely heavily on the hospitality industry, or our families do, for employment. And many of our hotels locally do not think that, we're going to see the amount of tourists that we normally see in the summer. So, that is going to pose a big problem for a lot of our families moving forward.
Thank you for that, Marisa. I appreciate all the work you're doing along with the other presenters. And I agree with you. I think that there is certainly in our planning for funding, providing emergency funding, we are expecting that there will be a second wave of emergency need. There's an initial shock of this particular isolation process, and then there will be the economic shock that probably comes later that will continue to be an issue. So we're going to rapidly move here towards a Q&A. And the way I'll do this, I have one question that I meant to ask of the two food banks. But before I get to that, if I could just ask each of the presenters to think for a minute while we're closing out here, what would be the one thing that you would say you need most from the community for support? We've mentioned, some of you have mentioned this already a little bit, but if you wanted to summarize that at the very end of this presentation, we'll have an opportunity. I should turn my video on. Probably we'll have an opportunity to have each of you speak for 1 minute to just summarize based on comments you've heard and so on. Before I get to the Q&A, one question I would have just for clarification with the Summerland and Penticton food banks is if each of your organizations is eligible for the federal money that has been announced for food banks across Canada, and if you anticipate that having some kind of positive impact locally. If you could just, 30 seconds or less, let us know what you know about that program, that would be great. If we could start perhaps in Summerland with John, and then go.
Yes, hi Aaron. I don't think we're going to qualify for it. Our income has gone up compared to last year and last month and the month before. So I don't see us qualifying under the current rules. And again, I'd prefer to see that money go to organizations that are in greater need than we are. We do at least have some reserve on hand.
Great.
That's a temporary answer, because if things get really bad, obviously, I'm going to regret saying that.
And how about in Penticton?
That question is actually twofold, because there's two different sets of funding. The one that was about the 30% decrease in income. We've actually had to close our thrift stores completely, and that was one funding source of our food banks. And the federal money actually is being handed out nationally, so it's kind of being sent out nationally, and each association or agency is getting their share. So it's kind of like a national thing that's going right across the country. That's what Prime Pierre, that's what Justin Trudeau announced. And the provincial funding that was announced through BC provincial government, they actually have opened up for applications for funding to fund the over 100 food banks that they have over here. And yes, we have applied for that. We see our need going to be great. No man is an island, and neither are we in BC or Canada or even the world, because this has affected the world in the way the economy goes. And it's going to take a while after this is over for the economy to fully recover. So that's why we're saying that we need to be planning well past this. And we are, and we agree with Summerland. We are so blessed that we have so much, that we have food to hold us for the short term, but the long term is where we're quite frightened. And if this continues to go, we need support. And we need support both in food drives, the physical food drives, as well as the monetary food drives, and being able to find the suppliers that will sell to us in the volumes that we need. So quite a bit in one little sentence, but yeah.
Well, thank you. Thank you for that. So now I'm going to pass the baton over to Sarah, who has been collecting some of the questions and has organized them so that we can efficiently work through them. So Sarah, if you want to come unmute yourself and share some of what's been in the chat, that would be great.
Hi, everyone. Can you hear me?
Yep.
Great. Okay, so a lot of questions have been answered in the chat, which is great. So I'll start with the questions that haven't been answered, and then we'll go from there. So the first question, this is for Dr. Tim Phillips. What's the volume of patients being diverted through the assessment center right now?
So right now we have one doctor who's there for about 4 hours. I think they are seeing somewhere in the area of anywhere from 12 to 20 patients during that period of time. We are in discussions with the health authority to try and move the COVID testing office over to, so that we're combining in the same spot. So we do anticipate, if that happens, that the volume will go up there. And we also know that the volume, as offices start to run short on PPE, we anticipate the volume through the assessment center going up as well. So we do have had planned for the ability to increase the number of providers there and increase the number of hours, anywhere up to 2 providers for 4 hours a piece each, and 2 shifts of 2 providers.
Great, thank you so much. Okay, so before I get to the other questions that have been answered, there was a comment made that if each of the organizations who presented today could put together a wish list of what exactly they need right now, as well as their contact information to be shared, so that way we know and the community knows how they can help. So either maybe just post it in the chat or post it in that Facebook group, so we can start sharing that information out, because I know a lot of the community wants to help, so we just need to get that information out there. So we'll do that.
I just wanted to speak to that for a second. We on our website, we are accepting applications for, like, formal applications for emergency funding, but I kind of think that we should probably supplement that also with something where the organizations can simply list more informally the things that they're needing from the community. And we can make that available to the public as well. And perhaps even some of the formal applications, we could ask the applicants if they're interested in making those applications public, so everyone in the community can see what it is they're in need of formally as well. So that's something to consider for us.
Great. Okay, so I'll address some of the questions that have been answered in the chat room, but just in case you missed it, then I'll just summarize it a bit. So one of the questions was, what kind of help do you need for Starfish? Tracy answered they need donations. As she mentioned, they're moving to a gift card system. So donations are, cash donations, I'm sure, are greatly appreciated. But she did mention you can follow Starfish Backpack Program Penticton on Facebook, and they post a lot of updates. Someone else asked if the Starfish Backpack Program is only open to elementary, or if it's open to youth as well. And currently right now it is only in elementary schools, but like Tracy said in the chat, they're working with school district 67 on getting those hampers out as well too. So it will be open to youth and everyone in the whole school district 67. There was a question to the Summerland Food Bank and Resource Center, or where are the folks using your showers? Where are they coming from? And John answered that they're typically living either in their vehicle, in garages, and some type of inadequate housing. So they're coming to the resource center to shower, which I think is great. And I'm not sure what's going on here in Penticton, but I don't know if there is any showers available to any of the Penticton residents. So if someone on this call has an answer to that, that'd be great. Maybe just post it in the chat. And then there was a second question, was where are clients coming from that are using the Summerland Food Bank and Resource, if it's just from Penticton or Summerland. And currently the Summerland Resource, they cover Summerland and they have to check ID for that. But if someone is in need, then they help them out. And then I had a question if the Salvation Army could either chime in or just post in the chat, but could you send us your hours of operation again, just so we have it clear? And then a list of your most needed items, which again, that came back to that first comment there.
Yeah, our phone number at our food bank is 250-492-4788. And most needed items, the weather's getting warmer, so we need water, juice, some of the typical things, peanut butter, pasta sauce, canned goods, things like that. So we would really appreciate that. Hours of operation are 9 to 4, closed from 12 to noon, Monday to Friday.
Close from 12 to 1.
Closed from 12 to 1, sorry.
Great, thanks so much. And does anyone have a comment on where some of the folks in Penticton are using showers?
I think the Presbyterian Church was doing it. I don't know if they're still doing it, but that's what I have heard.
Okay, thanks so much. All right. Well, that was all the questions in the chat room. There's a lot of really great information on there. So we'll try to summarize most of this and get out the information that was requested there. Yeah, and I'll just pass it on to Aaron just to sort of wrap it up.
Yeah, so I think let's run through the agenda. A couple of 30 seconds to a minute for each of the presenters. If someone walked up to you on the street today and said, how can I help? What would you have to say in terms of your area of service right now? So we can start with Dr. Phillips, please.
Sure, thank you. I mean, I think the biggest thing that we would like to do is reach out and say a great thank you to the community for continuing to work alongside healthcare workers for the support that we've been given, and to continue to follow through with Dr. Henry and the Provincial Medical Health Office and the recommendations that are coming out from her in her daily talks, along with from the BC Centre for Disease Control.
Thank you. And then Tracy Van Race.
So for us, because Starfish is for kids and I'm all about the kids, I would say that please watch for some information to come out next week for what School District 67 is going to need from the community, because the needs are going to be big and they're going to be supplies, but most importantly, they're going to be funds. We need to be able to feed all the kids in our community that are part of the school system. So please watch for that info and it'll come with contact information. But if anyone has any questions, please email me. I did put my email address in the chat box, but it's Tracy with no E at totalrestore.ca. Thank you.
Thanks, Tracy. And Tracy Comber from Superteria. I'm not sure if you can unmute yourself or if I need to do that for you. I'll try again.
Sure, either.
Yeah, hi.
Oh, there we go. I would say probably our greatest need is for continued cash donations. My biggest worry is where we're going to go after the 2 months that we've got this grant for, and how donations are going to go in the future for us, because up until now, we've been completely donation-based and volunteer-based. There was no grants that we ran with. So I guess that's my main concern, is just how we're going to keep going after this 2 months. Other than that, I'd also like to thank all the healthcare care workers, all the other agencies that are helping people to stay fed, and to your foundation for helping us out with that grant. One Sky for helping us out with administering the payroll for that grant. And I guess that's about it. Just hope everybody stays safe out there and keep on going.
Okay, thank you, Tracy. Thank you very much. John, I see that you commented in the chat, but did you want to just summarize, at least for the replay on Shaw, what it is that how you would answer that question?
Yeah, thanks, Aaron. Money is, of course, the most important and the most flexible for us. If we receive cash donations, we can direct those donations toward whatever the greatest needs are at any point in time. So that would be my advice. And plus, we can use bulk purchasing and so on, and basically get a better deal that way. But if people want to donate food, high protein, non-perishable is really, really great. We purchase in our food bank all the perishables: meat, eggs, cheese, vegetables, so we obviously can't take donations of those items, but we do purchase them. And the other important area is personal items, toiletries. You've seen the shortage of toilet paper. Those are the kinds of things. Anything that a family would normally use, we can distribute.
Thank you. And, Major Trickett and the Salvation Army crew.
Am I on?
Yes, you are.
Thank you. And I do want to say, going on what Superior said, we do thank everybody else too. When we're not working together, this cannot be defeated. So thank you to everybody. As like everybody else said, monetary donations are huge for us. The Salvation Army is an international organization, church. And in Canada, we've struck a deal with Cisco across Canada, and we have huge buying power for the dollar. For every dollar, we can get so much benefit out of that. But beyond that, we need food product, canned food products, stuff that'll last. Like we said, this is going to go on and on and on. Financially, we've seen our volunteer base, and we're totally volunteer based with other than 2 or 3 paid employees. We have 0 volunteers right now coming in, and that's okay because their safety is number one. We've had to actually go out and hire 2 extra full-time people. So monetary will always help us as well. But you know, I'm a pastor. I'm going to say this as boldly as I can. We need prayer as well, because I can see this getting worse in the next 2 or 3 weeks as well. Thank you again to everybody.
Yeah, thank you. And last but not least, Marisa from Desert Sun. If someone walked up and asked you, what do you need right now, what would you say?
Most probably cash or financial support. I'm really concerned too about where our funding is going to come from in the next couple of months. We rely quite heavily on donations. Rotary actually normally provides us with a huge donation towards our community kitchen. As I said before, 2 of Rotary's fundraisers are not going to happen, so I'm not sure if we're going to secure that funding for the next year. So that will make a big hole in our pocket. And then also, you know, we get a lot of donations, cash donations from private community members, and with jobs being scarce in the year moving forward, you know, that's another concern. How many donations are we going to get, and what is our cash flow going to look like to provide meals through our community kitchen?
Okay, thank you very much. Well, this concludes our first virtual town hall, everybody. I want to thank our presenters for being available 2 weeks in a row, because it didn't work the first time. I want to thank all of them for their service to our region and our community and our vulnerable citizens. It's obviously so much important work is being done here. I also think it's worth acknowledging that many of the participants on this call today are individuals who are also embedded in the community, working extremely hard to support our community during this crisis, but also every day throughout the year. So we hope to be able to showcase and spotlight many of those other organizations as we go forward with this project. So thank you again for your time, everybody. We really appreciate it. Please, if you're interested in supporting any of these organizations, either reach out to them directly or contact the Community Foundation, and we would be happy to assist you in that planning for supporting your local community and our community's most vulnerable. So please enjoy the rest of your day. Stay safe, stay healthy, and we look forward to seeing you again next week. Thanks very much. Have a great day.
Thank you.
Thanks, Aaron.